And summer, of course, beginning to heat up here, and so are the latest skincare fads. Dermatologist Dr. Julia Carroll is here now to break down the do's and don'ts when it comes to the hottest skincare trends. And Dr. Julia, how are you?
I'm great.
Yeah.
So there's some new trend called sunburn art.
Right. So have you seen these pictures on Instagram, on Twitter?
Yeah, they've been popping up all over the place lately, right?
So people are using either sunscreen or stencils, and they're burning themselves, or even worse, going into tanning beds, and they're creating these designs on their body.
Is that a moose on that one
know,
guy's belly?
what?
Maybe it's for the hand games. I don't know.
Okay.
So, there's a lot of things that worry me about this. First of all, that's clearly a sunburn. We know that one bad sunburn dramatically increases your risk of skin cancer. And then these marks are not necessarily temporary. So I see people with permatans, the sort of classic farmer's tan, years down the line. So as much as it looks trendy and cool, there may be some permanent damage here.
Yeah, I wonder what the attraction is. Is it kind of like having a tattoo without the permanency, I suppose?
I think that's what the idea is.
Wow, interesting.
Yeah, it's very strange.
Yeah,
so.
Maybe I'm just getting old, but it's like, that doesn't look attractive.
Well, and how much time would that take to do?
Well, you have way too much time on your hands, and that is like on your agenda.
Yeah,
Interesting.
lots of time, but very little effort. All I got to do is sit in the
Yes,
sun.
lay around. Wait, I'm reconsidering. That does sound all right. Now, sunscreen for particular genders, or
Right, so this is kind of a new trend in its marketing of the sunscreens, but I love it because anything that makes people wear more sunscreen is great for me. So this is a company that has gone after the male market, so they've targeted this sunscreen specifically for men, and it's actually supposed to also help decrease sweating, and it's a refreshing product.
Now, is our skin technically different? Like, is my skin different than you two ladies, and I need something different?
No, but you might be more likely to pull this out in the morning than the one that's pink or has the baby. This one is for babies. This is the one we use on my daughter, and I like this one because it's a stick. So again, it's just specific products that may be more appealing to one segment.
I'd end up using that for deodorant.
Yeah, really. Whoops. So it's more about like the branding and the smell and that sort of thing.
But you know what? Because men are a little bit, they're not as likely to grab a product, so they may, if it's black, looks more masculine.
Okay. Now, if we get a cut or a scrape or something, is there something you should do to prevent scarring?
So one thing you should do is not overuse hydrogen peroxide. So we have a little bottle of hydrogen peroxide here, and I see a lot of patients that will use this, and they keep using it, and this starves your skin of oxygen, which prevents healing.
Oh, wow.
So, the first time you cut yourself, that's great, but then after that, I'd opt for plain Vaseline or something like, this is Cicaplast B5, and we use this after all our laser procedures. It's great to heal skin.
Oh, good. Is it ever too late? Because, now I'm asking you a question for me. My 5-year-old daughter bashed her chin and has a big cut.
Scar under
yeah,
there.
now it looks like it could scar.
Well, there are some great procedures we do. We have some before and afters of laser procedures that we do. And lasers, we used to say, wait a year and then we'll see. But now for a 5-year-old, it's a little bit different.
Yeah,
I don't know if
look at the difference here.
That's incredible.
Right. So now there's actually some evidence that even for surgical procedures, if you laser before surgery, you're going to get the healing process going and you'll actually get a better scar.
Wow.
So
really?
lasers are a great tool in our toolbox.
All right, so it's kind of a multi-step process then. Use the hydrogen to kind of clean the cut first time.
And then plain Vaseline, maybe polysporin, and then a healing balm. But then really, if you're worried about a scar, get to your dermatologist for laser sooner than later.
Interesting. And now, what is greenwashing?
Okay, so greenwashing is, so grab that first one there.
This guy?
So this is a pet peeve of mine. So people come in and they say, oh, I love this product. It's organic. It's natural. So if you actually smell that product, it's very, very scented. There's a lot of actual scent in there, and it's really irritating. So, things that are natural are not necessarily better, right? So things like, poison ivy is natural. But we don't necessarily, wouldn't want to put a poison ivy plant on our skin.
Right.
So they're just trying to capitalize on this whole movement towards a greener environment that makes people feel good.
Right, they feel better about using the products. Versus something like this is Neocutis Bioserum, and this is a supercharged anti-ager. So that one I don't think has a lot of power behind it. The one that
Worked out over MacArthur.
Yeah.
You know that I just, every new thing, I'm like, what is it?
What is it? So this actually came from our medical literature. So this is a 1% growth factor is in this product. Increases the improvement of fine lines, wrinkles. They have claims of 7 to 14 days to see improvement. But it came from the burn victims. So we were using these products on burn victims. And then that's where the really good skin science comes from, is from medical, and it gets translated over into cosmeceutical.
Fascinating.
Yeah.
No kidding. Yeah, anything that says anti-aging, anti-wrinkle, right? Those are buzzwords, eh? Just
Yeah, like what is it?
But one of the things is, the difference between these two products is that has, I know, 1% PSP in it, 1% vitamin C and E. This one here, it just kind of says, I have vitamin C in me, but not
Yeah.
a percentage.
Interesting. All right, Dr. Julia Carroll. She's a dermatologist with Compass Dermatology here in Toronto. Thank you so much.